hair disorders, hair loss, everybody agrees and everybody knows that the incidence of hair loss is increasing exponentially globally because of maybe hereditary factors, genetic factors, environmental, nutrition, and so many more. Here we have Dr. Chinmanat from Bangkok, from Thailand, and she's actually an expert dermatologist for hair and skin, but her field of interest is hair, and we're going to discuss about hair with her. So, what do you think is the market of hair going towards? Do you think it's getting more and more difficult to treat patients, or you think we have better therapies today?
I think the hair disorders and hair transplantation is always like tremendous in the market because in the past we have only medical treatments, but now in the past few years, I think we have a lot of instruments such as exosome that you are the expert, and also the laser treatment, the PAT treatment, and also like the LLLT that you already know. So there are a lot of instruments that can improve hair loss, and I think you guys will be very interested to learn more in the GAS meeting.
Thank you. Before we actually start on the treatments, I think the first point should have been that do you think correct diagnosis, proper diagnosis is a key for getting good results?
Yes, I agree. Because sometimes if people diagnose the wrong disease and then they provide some, treatment that are not proper, so how can patients get improved? Because if you want to give them the laser treatment, the exosome injection, also maybe some other microneedling or something else, you have to make sure that your diagnosis is correct. So that is the key, as you said.
So yes, proper diagnosis, whether it's blood work, whether it is trichoscopy, is actually the starting point for getting proper hair treatment, and that is very important. Now, a very controversial question, okay? Do you think that hair disorders should only be treated by dermatologists and plastic surgeons? What is your take on this?
I will say both because not only dermatologists will see patients with a hair loss, but also plastic surgeons and also general practitioners. And that is why hair disorders is quite important if you can diagnose patients in the right way and also if you can provide the best treatment for them. So that would be benefit for all of us, not only dermatologists but also plastic surgeons and general practitioners.
But in India, we definitely see an increased incidence of hair loss disorders. Is it the same that you see in your region? Is it the same in Thailand? Are people losing hair earlier? Are more and more people losing hair? What is your take on this?
In my opinion, I think in India you might have more like androgenetic alopecia, while in Thailand, from my experience, a lot of people, especially in young female, they lost more hair because of telogen effluvium. But we don't see a lot of androgenetic alopecia, but there are quite some. Don't get me wrong, but there are more hair disorders in other fields like alopecia areata, also cicatricial alopecia. So that would be, nice for patients, also doctors, if they can provide good treatments.
Okay, I'm going to ask you quick questions, or rather one word about each treatment, and I want your opinion on this, okay? Just a short opinion. First, PRP.
PRP, in my opinion, it is effective, but not for everyone. So in my experience, I think it will be effective in 1 1/4. So you have to pick the right patients, and how we can select patients, that is a good point.
Peptides.
Peptide is quite okay to me, but I won't say it is not effective. I think it's also effective, but again, like you have to pick the right patients, and not every peptide will work. So you have to select good peptides as well.
Oral minoxidil.
Oral minoxidil, that is my favorite because I think everyone, if they don't have the controversy, I mean, if they can take oral minoxidil, if they don't have any heart problems or if they don't have comorbidities, then I will suggest oral minoxidil will be a good choice.
One of the earliest papers on topical finasteride is actually from Thailand. What is your take on that? Topical finasteride.
Topical finasteride is also good, but if I compare between topical finasteride and oral minoxidil win.
And last, had a very controversial topic, exosomes.
Exosome, maybe I might not see very good exosome yet, but Dr. Viro tell me that I have to try.